And it's not just the elbow. Like if you go up to hit a forehand, it's not just the elbow doing the work. You got to think about what your shoulder's doing, what your upper back, what your hips are doing, what even your feet are doing. So I like to look at it not just as the overuse of the elbow, but what is being underused elsewhere.
Welcome to the Fit and Healthy Denver podcast, where we discuss all things revolving around health, fitness, and wellness in the amazing state of Colorado, so you can get behind the scenes information from industry insiders, special events, and more. Coming up is our host, physical therapist and strength coach, Dr. Jamie Beauvais. And here we go.
Welcome, everybody, to this episode of the Fit and Healthy Denver podcast. I am super excited to have on Dr. Laura Lund, who is a doctor of physical therapy, as well as a fellow of applied functional science. And this episode is all about tennis elbow, what you can do to recover from it, what you need to be aware of. And if you missed episode 23, we also covered tennis injuries in that with Damon Gillette of the Denver Tennis Club. If you're a tennis fan, check that one out as well. But on to this episode. This is a very, very common injury in tennis, and most people don't have the right information. So we wanted to have Laura on, who's an expert in treating tennis elbow. And Laura, you're a doctor of physical therapy. I know what that is. Tell me more about this fellow of applied functional science. I'm not quite as clear on that.
Okay. Yeah, thank you very much for having me on. So the Applied Functional Science is, I completed a fellowship through the Gray Institute, and pretty much we kind of look at it as a movement specialist in that we were trained from the head to the toe on how to look at the body and how we move in three planes of motion and how to make it very specific to what that person wants to do. So we really want it to be authentic. So if you're a tennis player, a golfer, a runner, but looking at each of those joints and each of the muscles to move in three planes and get you back to your sport or activity or whatever you want to do in the correct way.
And this is very, very significant for tennis because we all know tennis is played in all three planes of motions. There's lots of rotation. There's forward and back. There's up and down. Lots of different motions. So we'll get into that in just a little bit. But let's just start with the basics, Laura, because a lot of people, they hear the term tennis elbow thrown around, but they don't necessarily know exactly what it is. So what is tennis elbow?
Yes, I do get that one a lot. So the technical term is lateral epicondylitis. So pretty much that means that the lateral side of your elbow, so if you're sitting with your palms up, looking at the outside part of that elbow where what we'd call your extensor muscles or the muscles that help to extend your wrist attach, get overused or inflamed, and they can lead to pain, irritation, difficulty with gripping things, doing kind of your daily activities. And so that's the medical way of looking at it on that outside of the elbow.
Okay. And so how does somebody know if they have tennis elbow or not?
I would say sometimes with it, it's a catch-all term. If you have pain on the outside of the elbow, I feel like someone's going to diagnose you with tennis elbow, even if you don't play tennis. But typically, if you have pain with like when you're gripping or moving that wrist, you'll feel it kind of isolated on that side of the bone, and it might radiate a little bit down into the arm. That would be kind of a general way to kind of get an idea of being possibly having that tennis elbow.
Yeah, and I think you touched on an important point there. With tennis elbow, it is a lot of gripping things, but it's not just with tennis, because as any tennis player will tell you, not playing tennis sucks, but then when they go home and they're putting up their dishes and it's hurting, or they're a businessman and they have to shake hands and they can't shake a hand because it hurts so bad, it really affects the daily aspects of your life as well.
100%. I agree completely.
Okay. What are some of the causes of tennis elbow? Because it can't be just playing tennis, because then everybody that plays tennis would get it. So why do some people get it and other people don't?
So usually we look at it as an overuse injury. So meaning that area is getting used too much for whatever reason. That could be from playing tennis, if it might be from gripping the racket too hard, or just doing that kind of repetitive movements. The big thing I like to look at with, especially my tennis players, but really any athlete, is what else plays into that. And it's not just the elbow. Like if you go up to hit a forehand, it's not just the elbow doing the work. You got to think about what your shoulder's doing, what your upper back, what your hips are doing, what even your feet are doing. So I like to look at it not just as the overuse of the elbow, but what is being underused elsewhere.
Okay. So you mentioned the shoulders. What else did you mention in there?
So like your upper back or your mid back, or what we call your thoracic spine, your hips also play a role. even your feet. Like if you have a really stiff ankle, maybe that changes the way you move. And so you don't get there as fast to the ball. So you start reaching with your arm a little more. And then all of a sudden your elbow and your wrists are trying to take over power, when ideally we should use it more from like our center muscles, like our core and our hips.
Okay. So in the case of like the hips or the thoracic spine, you're saying maybe there's under using them or under rotating through them. And because of that, they're hitting extra hard with like those forearm muscles?
Yes. Yeah.
Okay.
So pretty much if we can't get the motion from somewhere else to help us out, maybe we're using that elbow too much to take up of it. And that's where I've seen a lot of people who've gone through treatment before at either other clinics or other type of healthcare providers, had the injections, things like that, and they just don't seem to get back to where they want to. Everyone's focused just solely on that elbow, and they maybe didn't take that larger view to where we look at how everything comes to play. And I think that's unfortunately something that's been missed a lot.
Yeah. So it almost sounds, from that explanation, almost sounds like a technique issue.
Yeah, a technique issue. That can be technical, like in your tennis, in your actual tennis motions, but it also could just be you have some stiffness here or there that needs to be worked out or at least be addressed to help them perform better, and then take that to their tennis pro that can help them fine tune that into their game.
Yeah. And I have to imagine not only technique, but there's certain habits that need to be broken in order to get to the ideal technique to where this isn't stressing them as much anymore.
Yes, 100%.
Okay. How much would you say is habit versus how much is technique?
That's a hard question. Everyone's a little different in that. I think habits we develop over time, and we'd all love to say we have perfect technique, but if we kind of started off just kind of picking it up as for fun and not having the specific direction on technique, those habits have developed. And so it could be like a 50-50, but it just kind of depends on the person.
Okay. All right. And what is somebody, so let's say they're working on their technique. What else do they need to do to get rid of the pain and to be able to play?
Well, first thing is to get the pain in the area down. I mean, so that might be anywhere from having some soft tissue work or having some physical therapy done on it to help to relieve like the tension on that elbow to like bring the pain down. But then focusing also on creating that mobility, like freeing up the other areas. So when you are holding the racket or you're going up for a serve or a forehand or a backhand, you feel like it's not all coming from the elbow. So it keeps you playing without having to like take as much rest, because you're giving it a buffer zone. You're giving it some assistance from somewhere else in your body.
Kind of like you're redistributing
Yes.
all the power and everything from a hip.
Yeah. Like, so if you redistribute it, or you just, you space it out a little bit. So that's not just the elbow. You can use some of those bigger muscles. Like your butt's a lot bigger than your wrist muscles.
Yeah. I hope so. Yeah.
I hope so.
Yeah. Okay. All right. That makes sense. What are some of the roadblocks to recovering? Because this is a pretty common injury. A lot of people really struggle with this for months and even years.
Yeah, I think a lot of the roadblocks, some of them come from just kind of like what we're doing right now. Like maybe they don't know where to go to seek for treatment, or not getting it treated quick enough. They think, oh, it's going to go away. I went out and hit, it hurt, but then it recovered by the time I played next weekend, and they just kind of ignore it. And then it becomes into that longer process of becoming less of like the tendonitis, as we talked about, to like kind of like a tendinosis, meaning like it's no longer in that inflammatory state. It's actually into a degenerative state where it just can't react the way we want to. So one would be time. And then two, I think, is really getting the proper treatment for it, and having someone who can look at it from that whole picture of, it's not just sit there and rest. It's how do we keep them in their activity, but in a safer manner.
Well, and that brings up a good point, because I know one thing that I frequently hear is like, I knew there was something wrong, but I didn't want to see somebody because I didn't want to take time off of tennis. So how would you approach that for somebody who wanted to continue playing? They're a little nervous to actually have somebody help them treat it because they didn't want to miss out on the things they love to do.
I hear that all the time. I think that's, that to reassure them that, just because you have the pain doesn't mean you have to stop. It just might be like we talked about, like in your previous question was, if we can bring other areas of your body in to assist, that's less stress in that elbow. So it's just kind of helping your body perform better to where the elbow is not taking all that stress. There's lots of soft tissue work, and if they've ever had physical therapy, there's some dry needling techniques, different things that can help to alleviate the pain. But having that other kind of avenue of where we can really assist the body in moving more effectively, it keeps them in their sport. They might have to decrease the intensity just a little bit, but they're probably already doing that because they hurt. So they're, kind of a give or take there. It's like if you're playing not to your full ability because you're in pain, let's just adjust that just a little bit, but where we can get you where you don't have the pain, but keep you in your sport.
Right. Yeah. I think it'd also be kind of looking at that long term, right? Like you're not playing as well as you can right now. What do you think is going to happen if you don't do anything about it? And if I'm reading kind of between the lines of what you're saying, they're working on performance and improving their technique in order to get rid of this. So ideally, it would put them in a better position to either play better or be more resilient in preventing this in the future?
Yes, 100%.
Okay. And what would you suggest then for people to start working on this ahead of time? Let's say they don't have any issues, but all their friends have had tennis elbow and they're starting to worry about it. What can they start doing now so that they can try to get ahead of this and make sure they don't get tennis elbow?
Well, I think thinking about, having, good mobility, yes, the pains at the elbow. So you could do wrist stretches, shoulder stretches, but also like thinking of your spine and your hips. So like having a very three-dimensional movement workout or kind of routine, but then also throwing in the stability. So you have that kind of resilience to where the elbow won't take that stress. If you have that good motion, you've been working on that, that also might be a great time to then go see your tennis pro and be like, hey, I really like to hone in on some of my techniques. When I'm doing that backhand, I really feel that, when I bring that right arm across, it's getting that elbow. And so you can kind of take the PT or the movement side and then have the tennis pro or that professional kind of fine tune that and bring the technique side to it as well.
Okay. And so a question I have then is, let's say somebody's been playing for 5 years and then all of a sudden they kind of develop tennis elbow. Their technique probably didn't change that much over, a period of a month or so. So why they may develop tennis elbow after several years of playing tennis?
That can be, there's different things that fit into that. It could be as simple as they change rackets or they change their strings or something in that realm, but it could be maybe they've increased the intensity or they increased the volume. So you got to look for the variables and see what has changed. Other things, it's not always connected to that. There are, occasionally there's side effects for certain antibiotics. Even they talk about that can lead, put people at prone for kind of tendonitis and irritations in the tendons with that. That's a whole nother probably podcast. So it just kind of depends on what they changed. And if it just came on randomly, then there's probably is something that is different. Like what I've seen more recently with just the whole COVID thing is someone started working from home. They weren't used to working from home. Their setup is not ideal. While they didn't change their tennis routine, they did change kind of how they did their daily activities. And that was just enough to tweak it just a little bit. It got sore. They kept playing through it. And unfortunately, it kind of snowballs.
They've changed their workload on their body somehow.
Right. So it's not always, you kind of got to be we have to be the, kind of be the detective and figure out really where it came from. And it takes a little bit of picking through the stuff, but we usually figure it out.
Okay. All right. And so I know one of the most common things that people are going to turn to right away when they get tennis elbow are those little straps and like braces that they wear on their elbows or their forearms. What are your thoughts on those?
They're fine. they're a Band-Aid. If it gives them some temporary relief or it gives them some comfort when they're playing, I'm not opposed to it. It's not going to fix them though. So I'm, you know, I probably wouldn't prescribe it to one of my clients. If they've already using it and they like it, that's their choice. I think going at it from how we address the actual muscles and then everything around it will get you more bang for your buck.
Okay. And how long does this whole process take?
It varies, going by like the internet, they probably say 6 to 8 weeks, you rest and do some stretches and it'll go away, but like you said, some people have it for years. Some people have it, very temporarily. So it's very, very based on the person, kind of what's been going on, how long, or like how they kind of irritated in the beginning. So it's hard for me to give a set number. I do think the quicker you can get into physical therapy or to get it addressed and start working on those tissue and those limitations, the quicker your recovery will be. But again, it's looking at the whole body. You can't just focus on the elbow, or else I think it's going to be more of a yo-yo effect.
Yeah, that makes sense. And what would a typical session look like with you? Let's say somebody's come in and they've had tennis pain in their elbow for 5 weeks, and it's getting to the point where they can admit, hey, my tennis game isn't the same. I'm not playing the way I deserve to. What would that actually look like? Because I think a lot of people would love to see kind of a little window into what the process might look like for them.
Yeah. So first we'd come in and we'd do an assessment. We'd look at kind of the wrist and the elbow, kind of check the mobility, kind of feel how those tissues feel, but then check your shoulder, your upper back, and kind of work our way, like I said, kind of through the whole body to kind of see how everything is moving. In the beginning, I would say we do address the pain. I mean, that is why you're coming in. So we want to get the pain down. So I would probably do some soft tissue work to improve the tissue's mobility. If they're up for it, I would do what's called dry needling. So pretty much using a very small needle for a trigger point release to help to improve the blood flow and getting those muscles moving better. And then it just kind of depends on kind of what I find, but kind of work on those elbow muscles, but then work on the other muscles around it, and then build in some kind of light stability to start strengthening it and bringing in, like I said, the other muscles like in the hip and the back to kind of help take that stress off the elbow.
Okay. What about cross training? Let's say somebody wants to train, they want to play their tennis, but they want to stay active. Let's say it's so bad they can't play tennis. What else could they do to stay active that might actually help the process?
I mean, they can still do, obviously if they like to walk or run, things like that, I still go with them doing like some kind of cardio if they have not been a runner. I mean, if you're playing tennis, hopefully you have some form of cardio, but that can still continue. And I still think you can do forms of strength training. Maybe you're not using really heavy dumbbells or things like that, but you could use a cable machine or TheraBands to where you're adding a little resistance, but you're not overloading the wrist. And I would look at that from how, like, if you're doing like lateral movements similar to you would on the court, you can still mimic that, but without taking the elbow, putting the elbow in an area that would cause pain.
Yeah, that makes sense. So this all sounds fairly challenging. We're basically looking at the whole body, and you're trying to get somebody to play that maybe they don't want to stop playing, even though that can cause them pain. What about it with this population do you like working? Why do you like working with tennis players and tennis elbows so much?
I like it because it is a puzzle. I think that's fascinating. I think that's really any injury typically. Like you got to really kind of dig through the weeds and figure out, finding that root cause and helping them stay active in what they want to do. So I think that's the gratifying part of it, is when they do feel a little better and they go on and have that game. They're like, man, it was still a little sore, but I felt like I had more power on that forehand than I've had in a while. Like that's gratifying to me. But I get to be my own detective, and I get to really look through the mechanics. And that's kind of what I learned in my fellowship. And that's what I like about it. Like, it's not just picking one body part and sticking to it. But it is challenging. That's why it's good if you do have these symptoms, and even if it's pretty acute and you think maybe it'll go away, to have someone look at it to get that full kind of that picture and help you pick through some of the stuff that maybe you would waste a little of your time doing and get to the root cause versus kind of delaying the care.
What are some of the biggest mistakes that you see people do when trying to recover?
I think the biggest thing is like doing nothing. Like they're like, okay, I just stopped playing. I'm not going to move anything. And then they get stiffer. And then they, not just in the elbow, they get tighter in their hips and their back and everything else. And then they just feel like they're out of shape. And I mean, thinking about tennis, like you have to be quick on your feet. If you're not getting to that ball, you probably are reaching with your arms in a way that's not an ideal way to get there. So I think that's the biggest mistake, is just doing nothing or going straight to like injections and not even like trying anything else before going to the cortisone injection.
What is your general thoughts on cortisone injections?
I think there's a time and place for them. I would use them if needed. I'm not the biggest fan. I think because cortisone is a steroid, so it does have some degenerative properties. And if you already have an area that has some damage, putting that cortisone into it, I think can lead to more damage. And so I would rather take it from a standpoint of, let's treat it manually, let's get everything else helping it out, build up our strength, and then see where we're at. If we can't make improvement, we can cross that bridge and we'll refer you out to a physician that can perform that for you.
Right. Try the less invasive things first. Why do you think so many people, because that is probably the most common, or at least one of the most common treatments for tennis elbow, why do you think so many people jump to that so quickly?
I think it's partly a lack of knowledge. I think in our medical system, unfortunately, it's a quick fix, but it might not be a real fix. And so it's something easy and the doctors offer it. And so they take it. But I think it's more if they understood more the process and what's really going on. And, we could get you better without having to put medication into the body and do it in a way that really will help your game overall.
Right. Yeah, because the injections really wouldn't address any of the things that we've talked about in this episode. They wouldn't address the technique, the overuse, the overload, any of that.
No, probably give you some temporary pain relief, or unfortunately, I've seen a lot of people who've had no relief with it. So I think having that, coming at it from a little bit like almost more holistic-y way, and then kind of crossing off some of those things before you go down.
Yeah. And using that as the kind of ace in the hole if you have to use it while working on other things. Yeah, that makes sense. Well, what else do you think tennis players out there, or anybody else that's suffering with tennis elbow, because it's very common in weightlifting and other things as well. What do you think, anything that we haven't talked about that you think people out there should know?
I think the big thing is listen to your body. And, if it's starting to feel a little sore, think about kind of try to get ahead of it before it gets to the point where it becomes that kind of chronic thing, or like it's really starting to limit you. And think, if you're doing something, you're like, okay, that feels a little sore, whether you weightlift or you play tennis that day, did you change any of your technique, or are there any variables that came into it, or you just get off an airplane and then you ran out to the court and, things felt a little stiff. And don't put it off till it gets to the point where it's harder to fix. The quicker we can fix it, even if it seems like you're jumping on it too soon, you're not. I mean, we listen to our body and be proactive, and then think, how do we make our warm-ups better? How do we make our activities more authentic to the sport we want to play? And you try to talk about cross training. I love cross training. I think that's good for whether you're the runner, the golfer, the tennis player. We should cross train. It shouldn't just be the sport you want to perform. That's how we keep our body feeling good and all the different, places we're supposed to move.
Yeah, fantastic. Well, Laura, I know you got to run. And I know you are going to be at the upcoming Colorado Open, which, interesting fact, I read is the largest tennis tournament in the U.S. I know you're going to be there working on some of the tennis athletes. But if people have any questions, where can they reach you at?
Yeah, yes, I will be at the Open, but also they can reach me at Kinetic Chain Denver. My email is also laura@kineticchaindenver.com. And yeah, you can find us on the internet or give us a call at the clinic.
Okay. What is that number?
That number is 720-651-0674.
Laura obviously doesn't answer the phones, everybody. Didn't even know her own number, but but that's okay. We'll forgive her because she's given us a lot of good knowledge here. So, Laura, thanks for coming on. We really appreciate it. If you have tennis elbow or if you know somebody that could benefit from this episode, please share it with them and have them contact Laura and see how she can help. All right, everybody. Thanks for listening. Bye.
Thank you.
Thank you for listening to the Fit and Healthy Denver podcast, brought to you by Kinetic Chain Denver Physical Therapy. If you know anybody that you think would benefit from listening to this podcast, please share it with them. And don't forget to hit that subscribe button so you can enjoy all the great information we're bringing you in the next episode.